everyone, and welcome to Rad Chat live here in Liverpool at UKIO. My name's Jo McNamara and I'm joined by fellow host
Norman Joker Anderson.
So we've got our first guest of the second day sitting on the Rad Chat sofa. Would you like to introduce yourself, please?
Yeah, I'm Andy Williams, currently a volunteer patient safety partner. It's a specialist volunteer role in my local hospital. I like to think that I'm into my third career now, having qualified as a therapeutic radiographer way back in the late 70s. I had a clinical career that lasted about 29 years or so.
Not long then.
Not long. And because part of my role was doing quite a lot of outreach teaching for district nurses, GPs and oncology nurses, as part of the role I really enjoyed, and I thought, if I'm going to do it, I'm going to do it now. And one of the first questions my head of school asked me at the interview was, why now?
Yeah.
And my answer was, well, because I can. So that career took me through all sorts of things, from course development of learning and teaching materials, particularly around clinical governance, patient safety, and getting our learners to recognise that there is more than just treatment delivery.
Yeah.
And one of the strands was very much around being that champion of change. So even small things for one patient is going to make a difference.
Yeah.
And then, having decided to finally retire...
That's when the work really starts, isn't it, when you
Indeed.
retire?
So my retirement lasted all of 12 months. I thought about volunteering. I thought about then hospital volunteering. And then the role of patient safety partner, I still profiled it as job of the week.
Yeah.
And I looked at it and I thought, I've done all of those things.
Yeah.
I've either worked with them or I've developed the teaching materials.
Yeah.
And I'm currently attached to the Division of Medicine. And because of various reorganisations across the Trust, that division now takes in network services for renal and for cancer.
Right.
So I'm linked up with radiotherapy again.
It's like a full circle, isn't it?
It is,
Yeah.
it is, yeah, very much. And as far as why I'm here this week, having attended last year for the first time for many years, and I packed all 3 days with all sorts of things.
Yeah.
Well, this year I'll come back and a more sort of relaxed approach, so that I could take time to meet up with people. But I'm also showcasing a poster which is looking at the 15 Steps Challenge Toolkit, which we kicked off in older persons medicine round about this time last year.
Right.
Recognising that the whole project from its inception tended to be walk-arounds by senior matrons as part of their assurance rounds. But when you work in an environment every day, you tend to miss
Yeah.
some of the subtleties in the environment. And the matrons wanted something a little bit different. They wanted almost a fresh pair of eyes. So using a whole range of volunteer observers,
Yeah.
we kicked off 15 Steps with the 8 wards in older persons medicine. Then we adapted the toolkit slightly to make it more specific for haematology and oncology in patients, based on the premise that not everybody has a smartphone, particularly the over 65. There's something like 4 million people that don't have a smartphone. About 2 million don't have access to the internet. And that digital divide gets bigger
Yeah.
as you're looking at the older age group, so over 75, for example. So using those independent observers acted as the eyes and ears, if you like,
Right.
for those patients who perhaps wouldn't otherwise have a voice.
Yeah.
My involvement came because when we were thinking about all the comments that we were getting, well, what are we going to do with them?
Yeah.
And I wouldn't say I stupidly volunteered to do thematic analysis, because I've always been a quantitative researcher.
Yeah.
So looking at alternative methods, I thought, well, I could do the thematic analysis, and actually it's been enlightening. It's been encouraging, because I think very often we tend to focus more on the things that have gone wrong rather than the things that we do well and we get right. And perhaps that's, in a safety-conscious society, perhaps that's right.
Yeah.
But then we have a tendency to lose sight of all that good stuff.
Yeah.
And what was encouraging from the results combined across both older persons medicine and haematology oncology was that something like 25% of the comments were things that we could consider for change.
Right.
And so we've already seen changes in particularly older persons medicine. Simple things like having a common approach to the information contained on the visitors and patients information boards, for example.
Right.
Tablecloths, a China tea service, so that those people who can and are mobile enough can sit around the table, have a gossip,
Yeah.
have a cup of tea or a cup
Doesn't
of coffee
feel like a healthcare
in-
setting, does it?
in a nice porcelain or china teacup.
As opposed to what you get in the hospital.
Absolutely.
Plastic beakers.
You know, and so going back to what I was saying about being that champion of change, what we've been able to deliver are those small and subtle changes.
Don't you think that
actually
fits
make a
quite? I was
difference.
going to say, don't you think that matches UKIO's kind of entire premise this year about humanising healthcare?
It does, yeah. And I was thinking about this last night. The reason I got into radiotherapy in the first place was the technology.
Yeah.
The first time I saw a radiotherapy treatment machine, I thought, wow, look at that, that's amazing.
Yeah.
And it wasn't until I was going home I thought, they put patients under those things. That must be really, really scary. And the thing that's always driven me is, how do we use that technology to the best advantage for our patients? And so, as you said earlier, full circle.
Yeah.
We've got all that technology now, but there are some people who perhaps don't engage with it,
Yeah.
or they're frightened of it. Let the technology do a lot of the traditional stuff that we used to do,
Yeah.
gives us more time to put that humanity back into that
Yeah.
person-centred care, if you
Yeah.
like.
Yeah. Oh,
So
brilliant.
that's what brings me to UKIO again.
Very deep but amazing. Yeah, it's been great to have you on and chat with us.
Thank you for inviting me.
Can I just
been
ask
great.
before we sign off, because I can't not, because Lindsay will kill me, but Radiotherapy UK, tell us a little bit about being an ambassador and why you also do that, as well as obviously everything else in your retirement.
Yeah, okay. So having settled into my role as the patient safety partner and having cancer services as part of the division,
Yeah.
again I saw on the Radiotherapy UK website a call for ambassadors, and I thought, I can do that because I'm settled into that other role.
Yeah, yeah.
It's like, well, another role won't make a great deal of difference, but also it keeps me in touch
Yeah.
with my original background.
Yeah.
So although, if you like, my skill set has grown, I've still got that foundation in radiotherapy.
Yeah.
And one of the things that we've been able to do locally is, in the run-up to the launch of the National Cancer Plan, was to get one of our local MPs down to the hospital.
Yeah.
She was looking particularly at robotic surgery
Right.
for colorectal patients. But she also popped into radiotherapy, gave us the opportunity to not just talk about the local issues
Yeah.
that the department is facing, but I was invited along to put the national perspective. Out of that, there are now questions about sustainable funding for workforce,
Yeah.
for equipment,
Yeah.
and she's also raised questions about reviewing and revising the radiotherapy tariff, because
Yeah.
it's just not
Yeah. Fit for
meeting.
purpose.
It's not meeting today's needs.
Yeah.
So yeah, joining all of those things together,
Yeah.
one of the biggest challenges for me has been that change of focus from this is what we do
Yeah.
for our patients to being the voice of those patients,
Yeah.
and actually being able to challenge some of the things that I used to see as sort of everyday life. That's the way it is.
Yeah.
Now I'm in a position where I can be perhaps a little bit more contentious than I usually am,
Yeah.
to actually say, well, hang on a minute, that might feel right, but why? So it's being able to take that step back and actually think, does this feel right? Is this going to be safe? What impact is it going to have?
Yeah.
So it's like that independence, but driven by everything else that I've done over the last few years.
Brilliant. Oh, well, thank you so much for joining us on the Rad Chat sofa.
You're welcome, and thanks for having me.